You're listening to Health Professional Radio. My name is Wayne Buckler. Today I'm joined by Nehemiah Richardson, the General Manager of NAB Health. And Nehemiah joins me today from Western Australia. Welcome to Health Professional Radio, Nehemiah.
Yep, thank you very much, Wayne. It's great to be here.
Now, can you tell me a little about NAB Health and the services you provide and what geographic footprint it is? Because it's not a brand that springs instantly to my mind.
Yep, no worries at all, Wayne. I guess first thing to say is NAB Health is a business that sits within the National Australia Bank here in Australia. Mm-hmm. And we're a business that was launched in 2007, actually, and it was born out of our business bank because we're a leading commercial bank here in Australia with a recognition that the healthcare sector itself had some very specific needs. And as a result of that, we wanted to build a business that would specialize in understanding the healthcare sector and all of those who run businesses or services within that, so we could provide better insight and support to meet the needs of those customers. So where we are today is we have 300 specialist health bankers in 11 locations around the country. We have dedicated credit support, so that is, people who help support, underwrite the credit or do the credit assessment to support our clients, as well as specific or dedicated product support. So whether it be an insurance specialist, a corporate superannuation specialist, a working capital management specialist, or a deposit specialist, we have for all of the products and services that we provide as an organization, we have dedicated individuals across those product sets to service our healthcare customers. Within that, we have three brands. The first is HiCaps, and HiCaps is a very significant player in the health claiming market. Yep. So many of your healthcare professionals are probably familiar with HiCaps. Not all of them would necessarily know that National Australia Bank owns HiCap. The second is a business called Medfin, which services the practitioner market, and then the NAB Health brand, which services individual practitioners, right through to significant corporate size service providers, being large hospital providers, public hospitals, as well as aged care.
It's interesting that NAB's kind of dedicated a business to the health vertical. What are the characteristics of the vertical from your perspective?
Sorry, in what context do you mean?
I'm just, are health professionals so different from other professionals that it kind of justifies a different approach?
Yes, I think there's a few different things. One is, there's 70 to 80 cents of every dollar that's actually spent in health comes from government. Yeah. So when you think about it, it's whether it's the PBS or the pharmaceutical benefit scheme, which kind of has a big influence on the economics in the pharmacy industry and the whole pharmacy value chain, from pharmacist to manufacturer, or the MBS, the medical benefit scheme, which, is a subject to lots of bulk billing, but in the end, most of primary health care is actually funded by the MBS. In aged care, you have Living Longer, Living Better reforms. Across the board, in every sector across the continuum of care, a significant amount of the GDP that gets generated and the funding that's provided into those sectors comes from government, which means whether it's state or federal or state or commonwealth. And so what's important is, in trying to support our customers, it's not always the case that our customers will be on top of every single reform or all the changes that might be mooted until they sometimes happen. So it's really important to actually have, in our view, it's very important, to support investment and growth in those sectors, to have a partner who has the scale and capacity to have a deep understanding of, the specifics that go around, how these businesses, whether they be in primary healthcare as individuals through to, corporate operators, that we do have that level of understanding so we can actually support our customers to thrive in that environment, as well as to support our customers to adapt and change as things change.
It does certainly make sense, and that idea of a banking service provider with a deep understanding of how your industry sector works, I think is just invaluable. And certainly there would be lots of people who are health professionals who have been very frustrated by the idea that their financing doesn't understand the way their business model works.
Yes, absolutely. And we found that as well, which is why the way that we try to support our customers has significant regard to that understanding, which then allows us to do things that might be more bespoke for health customers and for I guess more diversified or generic type customers. And that's why it's also important for us to have this dedicated credit stream, so the people who provide credit approvals to support our customers and our frontline bankers are dedicated to health as well, so they maintain that I guess call it intellectual property and understanding, because it is a dynamic environment, health, and you really do need to have that level of understanding today as well as to anticipate what's going to happen tomorrow.
Nehemiah Richardson, General Manager with NAB Health. The art of the possible is something that obviously occupies a lot of your time, and it's a pleasure to discuss with you. And it's a pleasure to discuss with you what you see happening in the health vertical. Your passion is clear and evident, and I'm sure we'll have lots of listeners very eager to get in touch and engage with NAB Health. How is the best way they do that? Is it a website?
Yes, you can go to the nab.com.au website and just search health, and our landing page will come up, our health view and our health insights will come up, and contact details for the key leaders in our business, including myself, are there. So you'll see our email addresses as well as our phone numbers, depending on what geographic location you're in, and we're more than happy to take your call and to do what we can to support people across the healthcare industry.
Well, today we might have managed to spread a little bit of the word about NAB Health and NAB Health, and I certainly can see many of our listeners having an acute interest in your vision for the world. Thank you for your time today. If you've just joined us on Health Professional Radio, then you've just missed a very fascinating conversation with Nehemiah Richardson, General Manager of NAB Health. But the good news is we have a transcript on our website. You can also hear the original audio on YouTube and on SoundCloud. This is Wayne Buckler for Health Professional Radio.